Welcome to Pediatrics and Neonatology. This video is about pediatric murmurs. I will talk about normal heart sounds, breathing of murmurs, and sites of auscultation. Now first the characteristics of the normal heart sounds. It consists of S1, S2, S3 and P2. S1 is the first heart sound and it may split. S2 is the second heart sound and it normally splits with respiration. S3 represent normal rapid ventricular filling and P2 is the pulmonary component of the second heart sound and it should be soft. Now the epidemiology. 50% or more of the children have a murmur. 2 to 7% of the murmurs in children represent pathology. Now murmurs are graded for intensity on a 6-point system. First is grade 1 murmur. These are very soft murmurs which are detected only after very careful auscultation and only in a quiet room with a quiet child. Next is grade 2 murmur. It is a soft murmur which is readily heard but faint. Now grade 3 murmur. It is a moderate intense murmur which is not associated with a palpable precordial thrill. Then grade 4 murmur. It is a loud murmur and palpable precordial thrill is not present or is intermittent. Now grade 5 murmur. It is a loud murmur which is associated with a palpable precordial thrill and this murmur is not audible when the stethoscope is lifted from the chest. Grade 6 murmur. It is a loud murmur which is associated with a palpable precordial thrill and this murmur can be heard even when the stethoscope is lifted slightly from the chest. Next I will discuss the sites of auscultation of murmurs. Now in order to understand the sites of auscultation of different type of murmurs, please see the figure and correlate the following points. Site 1. This is the site which corresponds to the location of the carotid arteries. Common murmurs heard here are of the carotid bruit and the aortic stenosis. Now murmur of the aortic stenosis is usually louder at the right upper sternal border and often has an associated ejection click. Next is site 2. It is the location of the aortic valve and it is at right upper sternal border. Common murmurs heard here are supravalvular aortic stenosis, valvular aortic stenosis and subvalvular aortic stenosis. Now valvular aortic stenosis will often have an ejection click whereas the others will not. Then site 3. It is the location of the pulmonary valve and it is at left upper sternal border. Common murmurs heard here are pulmonary valve stenosis, atrial septal defect, pulmonary flow murmur, pulmonary artery stenosis, aortic stenosis, coarctation of aorta, patent ductus arteriosus, total anomalous pulmonary venous return. Now site 4. It is the location of the tricuspid valve and it is at left lower sternal border. Common murmurs heard here include ventricular septal defect, Still's murmur, hypertrophic obstructive cardiomyopathy, tricuspid regurgitation, endocardial cushion defect. Then site 5. It is the location of the mitral valve and it is located at the apex. Now common murmurs heard here include mitral regurgitation, mitral valve prolapse, Still's murmur, aortic stenosis and hypertrophic obstructive cardiomyopathy. And the last is site 6. It correlates with the areas of venous confluence and the common murmur heard here is the venous hum. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health related videos.